So let's learn about the neck. A lot of times patients come in for facial consultations and we ignore the neck. We forget about it. So you have to treat the face and the neck as a whole. You can't just treat the face and expect for the neck to be beautiful, vibrant, and glowy the older we get. So common complaints that I get is starting to get some heaviness right here. This is called jowling. The jawline not being so defined, and then these platysmal bands showing, and then horizontal necklines, neck laxity, and fullness. So how do we fix this? First thing is a 5-minute neck lift. I have several options and I'm gonna cover lots of different options. The goal is to just give you information, and then whenever you come in for your consultation, I will tell you what's an appropriate treatment for you. So 5-minute neck lift is what? I combine two different things together. I combine smooth threads and I combine a Nefertiti neck lift. So smooth threads is, I would put it anywhere that's lax. So if this area is a little saggy, then I would put some little smooth threads here. You can put them here. You can put them anywhere on the body. But what is the point? It's going to help the body build more collagen. So it's going to help tighten up that skin, help with any kind of etched in wrinkles that we have, and also help with scarring. So it's like a little Botox poke that goes in, and then I leave a little thread left behind. Patients say, well, what is a thread? A thread is like whenever they do stitches, like whenever you get a C-section, let's say. The doctor sutures, which is stitches, whatever they need on the inside, and then it slowly dissolves over time. So same thing with this, but we're gonna use it to stimulate collagen. So I'm gonna use a Botox poke. I'm gonna go under the skin, and then I'm gonna leave a little thread there and pull it out, but I'm not physically stitching you. It takes 2 seconds to do. So Botox poke, leave the thread in, I pull it out, and then that thread's gonna slowly dissolve over about 3-4 weeks, something like that. And it's gonna build the collagen as it's dissolving. Usually you need a few sessions of this. It's not a one and done. So you can get it by itself, or you can get it in the 5-minute neck lift. The other component of the 5-minute neck lift is called a Nefertiti neck lift. So this is where I inject Botox, Dysport, Jeuveau, Daxxify, any one of the neurotoxins onto the neck itself. So these beautiful bands are called platysmal bands. What are they responsible for? They pull everything down. So if I'm having somebody that's complaining of one natural band itself, or two, everything's starting to come down, then I say, well, let's soften that. Botox or any neurotoxin has the opposite effect of what the muscle naturally does. So if I inject these, it's not going to pull down, it's actually going to lift. So it's gonna help sharpen the jawline, help soften these beautiful little bands, and help tighten up the neck. I actually start above the mandible where the platysmal attaches, and then I go all the way down. So that's called a Nefertiti neck lift. So in a 5-minute neck lift, you get 10 smooth threads and a Nefertiti neck lift of 30 units of tox. But some people, they do it separate if they don't want to commit to the whole 5-minute neck lift. Next thing is, a lot of times patients complain about these beautiful horizontal wrinkles. Those are pretty hard to treat, but we do have options. The first one is called microtox. So along those little horizontal lines, I deposit microtox of Botox. So this is little baby amounts of it, and you actually leave, it looks like a little pearl necklace that you have for about an hour or so before it flattens out, but that helps soften that etched in line. We also can add a filler called Redensity to that area, which is a new filler that works really well with that. It's soft, it's natural, it blends beautifully in the tissue. So we can inject that specifically along those lines. That's probably my two most popular for the horizontal lines. Now, let's just say that sounds great, but I'm concerned with general laxity to my neck. I don't like the skin that's coming down anymore. 3 options for that. That would be Sculptra. Sculptra is a biostimulator. So it is powder and water. I mix it together, and then I inject it under the skin, usually with a cannula. So it'd be like 2 needle pokes, and I can do the whole entire neck from 2 needle pokes. But I give your body the tools to give it a little pep talk and say, hey body, start producing your own collagen. So it starts to produce its own collagen to make the skin not so lax. So Sculptra is a good option for that. Usually it's not a single session. Usually I need a few sessions of it, but I can customize that specifically for you in your consultation because everybody's different. If you don't want to use Sculptra, then you can also inject PRF gel. PRF gel is something that I get from your blood. I draw your blood, I spin it down, I heat some of it, I cool some of it, and then I make an all-natural filler. And we can use that to inject either in the horizontal lines or just for general laxity as well. That's going to help your body produce more growth factors to repair itself as well. Usually I do a few treatments of that too, so we'll customize that during your appointment. Now, if you're like, okay, lady, that sounds great, I'm not into injectables. Can you help me and it not be injectables? Absolutely. Chemical peels, a deeper chemical peel helps with that. It's just not phenomenal. So I'd rather save that for a conservative type of patient, or if we're on a small budget or something like that, that would be a good thing to do. Or if you want to take it up a notch, laser. Lasers are a really good way to go. So my favorite is the Fountain of Youth. This is where I do RF microneedling, I do fractional CO2 resurfacing, and then PRF topically. So I usually treat the face and the neck, but the neck, it's so good to help your body build its own collagen. Usually I do a few treatments of that as well. That comes with about a week's worth of downtime, so a week's worth of redness, itching, irritation. The treatment is fully customizable, so it's not a one-size-fits-all, so we determine how aggressive you want me to be and how much downtime you can give me, and then that's how I determine settings to actually treat you. Now, if you like, that sounds great, I don't want any downtime, but I want some form of laser. RF microneedling, so microneedling with radio frequency is another really good option for the neck. That leaves you with redness for about 2 hours, and then you can wear makeup the next day. So it's a really good option to still tighten up the skin but not have all the downtime. So we can do face, neck, we can do any body part. I just recently did my belly to help with skin laxity. So that's another really good option, and I always throw PRF on top after just to help the body recover quicker. So I know this is a bit overwhelming, but the neck is super complicated. So you don't have to stress. We customize all that in the appointment. That's the whole point of consultations. And then I customize price quotes for each one of you. It's not a one-size-fits-all. I really want to make this for you and what your goals are. So if you're interested in that, book a consultation and I will help.